And to begin with yourself, Dr. Fernando, we are here focusing on renal care because it's a super important, timely and topical conversation, not only in the UAE, but also in the region. And may I begin by asking you to introduce our audience who might not be familiar with Diavirum, and also the meaning behind the name and what Diavirum is doing when it comes to M42 and the great work here in the region.
Yes. Good morning. Thank you for your question.
And I may just ask you to bring the mics.
Let me start. Well, you want me to start with the name. D from dialysis, verum from veritas, true, the meaning of this. And I think it works quite well for us. 90% of our activity is hemodialysis today, and we practice true care, so it's a very good name. And let me also tell you that Diavirum is a Swedish-born company that has been acquired by M42 in 2023, and now with M42 we are present in 26 countries. Being a Swedish-born company, it comes from Gambro Healthcare, that was one of the pioneers in the dialysis field, close to 30 years ago, and we have an expertise on dialysis that it accumulates now 30 years of expertise. And there are some specificities of our renal care model that make us unique. Let me start with dialysis. Dialysis is a treatment for chronic kidney failure on patients on last stage of kidney disease. And the patients sit for 4 hours in average 3 times per week in a process that has 152 steps. So the first thing that we need is to guarantee the maximum safety. And this links to governance that we spoke yesterday. And for that, in Diavirum, we have a principle where we have policies and procedures for each step, and we have all the pathway, all the framework for dialysis digitalized. Our nurses have an iPad that with what we call the treatment guidance system, and they follow all the steps. So it's one of the first things that one of the pillars is the clinical standards and this digitalization and doing the same. So that at the end of the day, we want to be sure that the patient that we are treating in a Lagomar clinic in Uruguay or in a clinic in Sweden or Barcelona or Saudi or here in the Emirates have the same safety. Then we have other pillars for our care delivery model. And another thing is that chronic kidney patients are complex patients. 37% of them among us, in some countries more, have diabetes. They almost all have cardiovascular disease. They need a vascular access to do hemodialysis. So we decided many years ago that we wanted to have the same standards for all those comorbidities of our patients that we have for dialysis. So we developed programs for vascular access management, cardiovascular disease management, respiratory complications, all the other types of complications that we have in those patients that are very complex patients, and we decided to follow the same principle of standardization. And then we also digitalized all those programs to facilitate the life of our staff. So this is another thing in which we are quite unique on this governance and this standardization of care. Then we also we base everything that we do, and we try to develop evidence base of what we do based on the data. We have the same electronic medical record system in every single clinic, more than 480 clinics, and we gather all the data, and we developed a system that we call our clinical performance measurement system that very briefly, I will just say that we collect 31 criteria in 8 areas of care for all the patients, and we have individual scores for each patient that we use to tailor the care that we provide them, and also to analyze how we are doing in every pace. We can aggregate by clinic, by country, at corporate level, by specific interventions, whatever you want. So strongly based on data analysis. And we use that data to develop, as I was saying, evidence-based practices, and also to develop tools that we will speak about today, hopefully about AI tools and other digital tools based on that. On top of that, our care delivery model is, as I said, standardized, but is very patient-centric with an holistic approach. So on this patient-centric, on two areas that we also use is for this analysis, how our patients are doing, is patient-reported outcomes. And we measure health-related quality of life to all our patients every single year. And also we have an analysis of the patient perception of care. So these three aspects, the individual score, the health-related quality of life, patient perception of care, allow us to have a clear picture of what we are doing to the single patient and also globally or as a country or as a clinic. And this is extremely important. When we say patient-centric, this is the first step to be patient-centric. The other one is to have an holistic approach. And we have around our, and we don't like to call him patient anymore. We would like to call him a person that have a specific condition. And with this holistic approach, it's, of course, the nephrologist, it's the nurse, the nutritionist, the psychologist, the social caregiver. So everybody working together with patients and their families and to come with a treatment plan. And last but not least, two other areas that I think are extremely relevant. One is patient education. Health literacy promoting is critical also. If we want a patient to fulfill his treatment plan, we need to give him the right education and supporting to acquire his patient literacy. The other one connected with is to have top-notch staff training and education. And we train our own nurses with our own model to guarantee that they will deliver the same quality of care either in Uruguay or in Saudi or whatever. Finally, and I'm finishing, sorry for taking so long, but this is quite relevant. And finally is research. We promote research, we support our staff to do research because it's also the way to move forward.
Thank you so much, Dr. Fernando. I believe that he deserves a big round of applause for comprehensively taking us through this. I feel like me and my other guests, so we can enjoy this insight. I think you introduced many key points, which we're going to unpack with all of our speakers further. But that certainly sets the scene in terms of how Diavirum is unique in the provision of renal care, both here in the UAE and in the region. Now, you seamlessly allow me to bring in Dr. Carlos now on this note of the digital and AI role when it comes to renal care in the region. Many points Dr. Fernando has brought up. Please elaborate on them further.
Absolutely. Thank you, Amandeep, and good morning, everyone. So, as Fernando was saying, we have almost 30 years of renal care know-how, and our vision in terms of digitalization was actually to put all of that knowledge, all of that know-how into a digital platform. And that's exactly what we did. So, actually, as Fernando was saying, we have a platform that is present in all clinics of Diavirum. It's called DCare. And this platform receives data from, of course, from our clinicians and from our nurses, but also from our dialysis machines, directly from the labs, from other hospitals, from patient-reported outcomes, and is also the place where we do this patient performance evaluation or patient care evaluation. So it's a lot of data there. Also, another important thing in that platform is that we actually have guided workflows. So all of our clinical strategy that Fernando was saying, so we want to protect our patients' vascular access, we want to prevent them from being hospitalized. We want to for them to have the best quality of life possible. We have guided workflows in our system. So our medical staff and our doctors and our nurses actually follow the workflows that they have digitalized in the system. This not only ensures standardization of care, and it's what Fernando was saying, we should have the same level of treatment in a remote village in Uruguay or in London or in Stockholm, and that's exactly what we are aiming, but also allows us to capture lots of data, very standardized data, very accurate data. Now, and this is where I will bring up AI on this one. So, because of course, once we have all this amount of data, we can start thinking about developing AI technology. We can start thinking about using what is probably the most important technology of our day to learn from the data that we have to try to improve the outcomes of our patients. And that's exactly what we did. So a few years ago, we actually created a cross-functional team with clinicians, with doctors and nurses, data scientists, data engineers, software developers, and also project managing. Since the beginning, we were creating. And so the first step was deciding exactly what problems should we tackle in terms of AI. So at that time, generative AI was not usually available. So we were mainly thinking about predictive analytics. So being able to learn from the data, to predict, to anticipate outcomes in our patients in order to improve those. And so what we did was actually we focused in some very patient-centric approaches. So our patients, for instance, get hospitalized quite frequently. So it would be great to have a kind of an alert that this patient is at a high risk of being hospitalized before it happens, of course, to try to do something. Another thing has to do with vascular access. So our patients have actually a vascular access that allows them for the blood to be treating during dialysis. And it's actually a lifeline for these patients, but it has lots of problems. One of them is that sometimes it clots. So when it clots, it's not possible to do the treatment. So it would be great to have a kind of an advanced prediction. Is this a patient that is at risk of thrombosing the vascular access? And other things. So we can look also at the hemodialysis complications. We can look even at survival of a patient. Is this a patient that is at risk of dying or not? And that's exactly what we do. So the first model that we created was actually the vascular access thrombosis prediction model that we did. We used all of the data. We did all of the training in the model, and we came up with a very high-performance model for vascular access prediction. But this is not the end of the AI project. This is actually almost the beginning, right? Because then you need to deploy it in the whole organization. And this is quite an important step. And it's a quite challenging step. And it's exactly the step where many AI projects fail, especially on healthcare. You need to be able to deploy it. And so to deploy these kind of projects, this needs to create the digital infrastructure in the company, where we constantly monitor the performance of the model, and we can integrate the predictions into the workflows of our clinicians. So this means that the result of the outputs of the model, they go directly into our electronic health system. Then we need to train not only the models, but we need to train the humans also in the company. So we need to train our doctors and nurses to understand the output of the AI model. Because if you don't do that, then all of those data points and all of those predictions will just be there collecting dust. So we really need to do that. Then we need to focus on clear guidelines and protocols. So what the clinicians need to do once they get the prediction, what they need to do to the patient. Of course, we need to focus on actionable insights, right? So we need to focus on problems where there is actually something that you can do, that is possible, that is feasible. And that's exactly what we have been doing in this last few years, and with very good results, I have to say. For instance, in vascular access thrombosis, we have the indication that clinics using this model have a reduction of about 20% of episodes, which is quite significant. And we are looking now at hospitalization prediction and other models that we have to see where the advantage comes in. Okay?
I think, thank you first of all for battling against the very ambient sound. It picked up exactly at the point where Dr. Carlos said, we're not at the end, we're at the beginning. And I felt like we were on a Hollywood set as the crescendo was building. And you gave us a very long list of the vision and the impact that you want to create. And the music was accompanying you, I believe. So thank you very much for giving us that insight. And I think, yes, I think you are right. It does deserve the round of applause. I believe maybe our Group CEO is on the phone right now trying to ask them to turn the music down. But if he's not, maybe we should ask him to. So, you made some really valid points there, Dr. Carlos. There's a long way you have come, M42 diaphragm, and there's still a long way to go. You're right to say that you are iterating, you are learning as you go, and there's a lot of data collection, a lot of data analysis. And that's where, as Dr. Fernando set the scene, from nurses to the clinicians, the data is being collected. AI helps to analyze this further, but the challenges do persist. Before we get more into the detail of the challenges, let's set the scene and talk about key examples here in the UAE. Mr. Ziyad, you've been waiting patiently. I want to bring you in because we've had a very exciting announcement this morning here at Arab Health. Diaphragm has reconfirmed in terms of the operations here in the UAE. Please give us an insight in terms of that. And also let's delve deeper into what's happening here in the UAE with key examples.
So thank you very much, Amandeep. Good morning, everyone. Let's talk about the why, basically, in the place that we are sitting around, the UAE. It's not a surprise that the UAE has become the forefront of digital transformation in healthcare. And for us in Diaphragm, we think of UAE as a home, basically for bringing all the technologies that Dr. Fernando and Dr. Carlos have spoke about, to even elevate the current model of care. Basically, from what we see in this exhibition, and I've got a quick round, I can see even the regulators are approaching healthcare in more proactive method. And it's good also to operate in an ecosystem that allows you to flourish and show your true color in terms of true care values that they very much have embedded. So coupled with the artificial intelligence or technologies that can support the application both at the health provision and at the patient level, I believe that the integrated healthcare systems that both M42 and the healthcare regulators have adapted will be able to bring out the values out of the technologies that we are putting in. But let me talk about Diaphragm now and our plan to invest further and expand. We actually intend to come in through the Diaphragm platform, not only to provide the end-stage renal care dialysis, but to measure the outcome and move it from a traditional, reactive traditional healthcare model to a more of a preventive and a quality of life, which means that we are moving the model to more of a value-based, that even the market can appreciate the medical outcomes, the KPIs, the IPPS that Dr. Fernando talked about, to see the journey of the patient from day one, year over year, to improve the longevity and the quality of life for the patient. In addition to that, M42 have articulated 4 main platforms that sets or gels well with the service provision that we are giving. So combining these capabilities from service provision, not only in dialysis, but also from a diabetes care and chronic disease management, all the way to the integrated health and data services, moving into the AI and life science, I think no one else in the sphere, in the market or across the region have these capabilities to showcase and demonstrate. I think to add to that, and the last thing is that the clinical governance that Dr. Fernando talked about and all the digital tools that we are applying, from business perspective, we make it more of a measurable return on investment and something that can guide all the developments and the capital deployed in the market in order for us to measure how effective what we are investing and how relevant is that to the patient care and to the satisfaction of the patient, but also to the value creation in the healthcare sphere. And I think this is exactly why Diverum is very excited to be at this space, and I think at the right time, in order for us to show the true care model.
I think that's a super insightful answer, and you make so many significant points. And just to recap on what Mr. Ziyad's saying there, the idea of providing more preventative and holistic care, I think that really needs a round of applause, because I believe that's what it's all about, getting people before they get sick. And that speaks to the heart of M42, shifting from sickness to prevention, the key points you make there. And just to follow up with you, Mr. Ziyad, when we speak about diabetes and we talk about what Diverum is focusing on here in this region, the statistics, in a ballpark figure, this is very acute, this is very significant and a timely focus.
Well, we learn actually from both the lifestyle, the dietary habits that happens in the market, that within this region actually in general, we have something around 20% of diabetes patients, both types. The diabetes becomes a problem when we know that it's the leading cause for kidney failure. And what we see from our global network in Diverum, that we have over 40% of our patients who are getting replacement therapies are also diabetic comorbidities. So this is why prevention and early detection could help not only intervening, but slowing down the curve in terms of the progression of the diabetes and the kidney disease.
And that's a very astute point, because it really underlines what Diverum and M42 are doing here. As you all said, you used words like unique and how you're at the forefront, how technology is built into the model. Mr. Ziyad, you talked there about accountability, checking that the treatments are working, checking that where the technology is being applied is working effectively, learning and iterating. Now, before we cast our eye to the future, I know Dr. Carlos, you did give us some visions for the future, and the music was accompanying you there. So we're going to recap on some of those points. I'm just going to open it up to the audience. Does anybody here have a question for our illustrious speakers? Please don't be shy. I'm happy to share them with you just for a moment. Otherwise, I have more questions for them myself. Dr. Fernando, you've heard from your esteemed colleagues there many key points to set the scene and also give us some really key examples. Is there anything else that we should bear in mind before we start casting our eye to the future? When we talk about renal care and think about the future, is there any extra points that you'd like to add?
Yes, let me build on what they said, and let me talk about a dream.
Okay, I like dreams.
A dream that we will make true. And the first thing is that we will join the knowledge of Diverum for 30 years in renal care with the extraordinary things that we find here with M42, like a powerhouse in technology, in AI, a compassionate provider and this. And I think this will set the pace for the future. Let me talk about short, medium, and long term on this. On short, medium term, dialysis will be with us for the next 15, 20 years for sure, or even more. And why? Because when a patient reaches dialysis, it comes from a journey that started 20 years ago, either with diabetes, hypertension, or other diseases. So we will have dialysis among us, and we will have more and more patients needing dialysis. So we need to give them a better quality of life. And that, I think, our care model supports that. On top of that, we need to go into some other directions. We need to make dialysis better for the patients with some things like taking the dialysis treatment to home when possible, and also with technology development for miniaturization, for portable devices. So this is something that we will see in the upcoming years, and we will be in the forefront of that. But then, as Ziyad was saying, if we want to provide value, we need to be able to take care of these patients through all the journey. That I was saying, it starts way before they reach dialysis. And taking that into account, if we start early and we use all the tools that we now have to have precision medicine, to do the right things for the specific patients, we can delay a lot progression of the renal disease or even avoid it and avoid dialysis. For the long term, our goal is to avoid dialysis whenever possible. And for that, we need those tools. We need to use precision medicine tools. We need to enter into preventive care and preventing since the beginning through all journey of the patients. So I see this in the future. Just as another thing on what Carlos was saying, AI will help us a lot also on precision medicine even for the patients that are already on dialysis, where we can tailor the dialysis treatment to the specific needs of the patient. The other aspect that we will keep doing is to try to improve the quality of life of our patients when outside dialysis, promoting well-being, promoting wellness to all of these patients, and also promoting the access to kidney transplantation is something that we are doing very actively in our company, and we will keep doing that.
I think that's really important to emphasize those points that you make there, Dr. Fernando. They really speak to M42's main focus, the personalized, predictive, and precision care. So that's really important. Mr. Ziyad, if I may come to you, looking ahead to the future, continuing to add value, deliver value, where would you say is a strong focus for you?
I think our strong and main focus is going to be with collaboration. Basically, when we drive the adoption of the technology, we help the whole healthcare system costs come down. And this will make it more accessible, more democratized for other service providers. And we are very proud in M42 that we collaborate not only within the same M42 group, but also with technology providers across to provide that technology and make it available. The second thing that I think very important from a sustainability point of view is how friendly both to the environment and to the humanity in terms of the setup and the layout and the design of the clinics and the efficiency of the operation that allows the caregivers, the nurses, doctors to focus on their patients, both via using the technology Dr. Carlos was talking about, the TGS, where we can spend more time focusing on the patient and reducing human error and interaction. But also in terms of operating in a model that reduces the wastage, especially from water. We understand that as a dialysis company, we also discharge a lot of water. So how we can really utilize that water and clean it up and dispose it in a safe and eco-friendly manner. I think this is the key advantages that Diaverum with M42 can bring forward, not only to this market, but to the globe.
You make some really astute points there, really putting the focus on sustainability. And I love the fact that you talk about the environment for the patient. It speaks directly to the title of our session, being patient-centric, creating this wonderfully holistic environment. And as you say, collaboration, which speaks to the fourth P of M42, which is partnerships. So bringing in your partner on the stage, Dr. Carlos, final word with yourself. You did describe to us the vision going forward. Many of the key points you've all made, AI, technology, digitalization are central to the vision going forward. What would be your hope? What would be your call to action going forward when we think about these perspectives?
Yeah, thank you very much. And that's very important. So actually we do have one big important technology, which is AI currently, which we can add also wearable technology and data coming from wearables, and those two work together. But of course, the most important thing here, it's not the technology in itself, it's the value creation, as Ziyad was saying, and Fernando as well. So, and we need to create value to all the stakeholders, of course, for patients, but also for clinicians, and also for the national health institutions. Like if you reduce this kind of negative outcomes, we are, of course, making it more sustainable. In the future, I see, and also taking that point of moving upwards in the renal care, so not only dialysis but also pre-dialysis. So patients with chronic kidney disease that are about from 10 to 20% of the world population actually has chronic kidney disease. So it's very important to these technologies will fit very well on this. So if you are able to predict which patients are going to deteriorate their renal function, which patients with diabetes will actually have chronic renal disease, which ones will have problems, cardiovascular problems, etc. So all of this AI technology will give us this in the future, and we'll be able to act actually sooner. Then we have the whole other field of generative AI, which can also be used for patient app companions, for instance, because many of these diseases that lead to chronic kidney disease and to negative outcomes are actually lifestyle associated. So we can use and we can harness the power of generative AI to give recommendations on nutrition specifically for patients, on exercise, on lifestyle, on sleep, and all of this will, of course, make for a better scenario and easier to control these kind of situations. Yeah.
Thank you so much, gentlemen. This has been hugely insightful, timely, and very topical. You've given us very comprehensive answers. I wish that we could speak to you all further. You're brilliant, not only speakers, but expertise as well. And you provided that really deep dive into how Diavirum M42 are providing a unique provision when it comes to renal care. Ladies and gentlemen, for our first panel discussion of day 2, give them a big round of applause.